Hello, hello. Hi, everyone. Hope you can see me. Hello, hello. I'll just wait till everyone is here. Hi, happy Friday. Happy Friday. How is everyone doing? I will start when everyone is here. Happy Friday. Happy Friday. I haven't seen anybody yet, but once I see people, okay, I see three people. Okay, happy Friday. Happy Friday. Hope you guys are doing well. This is Q&A with Dr. Mercy. Hello, hello, hello. How are you guys? Hope you guys are doing well. Before we get into the topic, I wanted to see where you guys are viewing this live from. Hey, Sheila, happy Friday. How are you? Hello, happy Friday to you too. Okay, Diana, you're from Los Angeles. All right, happy Friday. Thanks for joining. Hey, Danielle. Wow, a lot of people. Leandra. Oh, no, I said it wrong. I'm sorry. Lysandra. Hi, how are you? Tommy, how are you? Morgan. Faith. Uh, Tawania. I'm sorry if I'm saying your name wrong. Hey, Megan. Oh, there's a lot of people. There's so many people. Harriet. Hi, Kendra. Florida. Okay. Kendra. Nice. Nice. Melody. Wow, there's just a lot of people. Cincinnati, I see. Oh, Donna. Good evening. Okay. Wow. Hello. Maryland, California, Arizona. Let me see. Is there any international people in the house? Bay Area is in the house. That's good. Chicago. Awesome. So we're all within the US. Oh, Toronto. Okay. Hey, Anne from Toronto. That I was in Toronto last month. So okay. Well, I was in Canada actually. I wasn't in Toronto. Houston. Hi. Brazil. That's awesome. Well, thank you guys for joining. There's a lot of people that are here. Yes, it is very popular and very important topic. So I'll just dive right in. Thank you so much, Morgan. So if you guys have any questions about the topic, let me know. But I decided that I wanted to talk about Alzheimer's disease and pretty much dementia in general. And this is going to be a two-parter. So the first one is just going to be about just in general what is dementia. Then the second part is going to be about how to prevent it if you can, and what are some treatment options, and what are some things that caregivers can do. So as you may or may not know, I work in the hospital. I am what they call a nocturnist. So I'm a nighttime doctor. And my primary job as a nighttime doctor is really to admit patients to the hospital. So if you are seen in the ER by the ER doctors and they feel like you need further treatment and you need to be in the hospital, they call me. So that's the reason why, that's what I primarily do. But on occasion, I also take care of the patients that are already in the hospital at night. So if you need something at night and the day doctors have already left, the nurses will call me and I can prescribe whatever is needed. So during the course of, I've been doing this job for about 10 years, I've oftentimes seen patients who come in and I can tell right away they have memory loss. They're older people, they have memory loss. And I oftentimes ask the families, I'm like, does this person have dementia? Immediately, like clockwork, they say, no, my mom, my dad, my uncle, no, he doesn't have dementia. So then I have to go on and say the next question, and that is, okay, they don't have dementia, but when you talk with them, is it similar to how me and you are talking? If you can recall, I'm talking to you, you're talking to me. We're having this very sync feedback. So you answer the question that I ask, and I answer the question that you ask. Are they able to carry a full blown conversation? And whenever I ask that question, that's when they're like, occasionally, but no, not really. And then I'm like, aha, um, what your loved one is suffering from is probably undiagnosed dementia. And I tell them that it's very important you know and you are able to get that diagnosis for your loved one, because with dementia, it's often a downward hill battle. The sooner you recognize it, the sooner you're able to put them on medications, the sooner you're able to recognize the warning signs and some of the pitfalls of dementia and treat them accordingly. There's been I could tell you multiple stories of people who didn't recognize that their loved one had dementia. And so like I can remember a story of one family member who just literally just dropped off their loved one in the hospital because they're like, we can't take care of this person. And all it was they were very erratic, because that is one of the symptoms of dementia. You have these erratic mood swings. They'll be nice to you in 1 second, and then in the next second they're like angry and they're cussing, and you've never heard them cuss in their life, but now they're cussing at you, or they may be physically assaulting you, and you're like, whoa, 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 what's going on? Well, had they realized that this person had dementia, they could have put them on the appropriate medications to calm those mood swings. So that's why, as I'm going through this, just think about some of your loved ones who may have memory loss, some of your loved ones who may be older in age, and start checking off boxes in your head to see, is this the case for so-and-so? Should they get evaluated? And then we can go from there. And if you have any questions, also feel free to jot them down on the actual comment section, and I'll try to get to them. Oh, great, Nicole Andrews. You're actually checking in from Gulfport, Mississippi, actually working on an Alzheimer's detection study. Great. We need more of that. We need more of detection of dementia in general, because Alzheimer's is the #1 cause of dementia, but dementia is very, very prevalent in our society. So I'm just going to jump right in. Let me see if I'm able to, just 1 second, you guys. The way it is situated, I hope I am able to, where did I have it here? One moment here. Okay, I got it here. I may not be seeing myself, but that's okay. I hope you're seeing the screen. Okay, so we're just going to jump right in. So Alzheimer's dementia. So dementia in general, what is it? Dementia is when people have difficulties with just common reasoning, with judgment, and memory. Those are the 3 obstacles that initially dementia has as its features. It goes further on. As you get further on in the stage of dementia, it moves on to them having difficulty with walking, with eating, with talking. So dementia is a progressive thing. When you have dementia, one of the common things one of my patients ask is, can they ever overcome dementia? No, you can't overcome it. Once you're diagnosed with dementia, a lot of times it is progressive, meaning it's a downward hill battle. The thing with the medications that we currently have in existence for patients with dementia is that sometimes, rather than it just be a very sloopy downward spiral, with these medications, they can slow down the progression so it doesn't go suddenly down as far as their declining of their normal either memory, judgment, reasoning, or their motor skills or their abilities to do their day-to-day activities. Some of these medications have helped to reduce that progression so it's not rapidly progressing. But also, depending on the dementia, each dementia is different in terms of how fast someone can go from being independently active and doing things on their own to being totally dependent, not knowing who anybody is, not knowing how to do things, and things of that nature. So Alzheimer's is just one of many types of dementia. And I can say to this with Alzheimer's, they don't really know why, what causes Alzheimer's. All they know is that when they, and I hope you guys are still seeing me, I'm going to go over here. They don't really know. Let me go back. Sorry. They don't know what causes this Alzheimer's dementia. All they know is that with Alzheimer's, that when they actually analyze the brains of those who have Alzheimer's disease after they die and they analyze it, they notice that these patients tend to produce abnormal proteins in their brain. So the body starts to produce these abnormal proteins that get clumped together and just go all over in the brain. And what is known is that anytime there's something abnormal, whether it's cancer, whether it's these proteins that is within a very close structure like the skull, if you start having these accumulations of abnormal tissues in your skull, it's going to affect the underlying brain tissues that should be used for reasoning, should be used for judgment, should be used for memory. It's going to affect it by damaging it. So they don't know why it occurs as far as why the body starts to produce it, but they do know that those who have Alzheimer's dementia, they have those abnormal accumulations of proteins in the brain. So it usually starts off, there's different stages of it, and I will talk about it in the next slide. But we could just talk about what are the general symptoms of Alzheimer's dementia. So typically, or just dementia in general. So typically you'll have confusion. A lot of times they don't know the date. I will ask them, a lot of times I ask them who you are. They'll know who they are. They won't know the time, and they definitely don't know the location. So those are the two things that they don't know. And depending on the stage of dementia they have, they may not even know who is sitting next to them as far as their relatives. They may not even know them either. A lot of times they have difficulty completing familiar tasks. So something like, especially as they get severe in the stages of their dementia, they may have trouble just like dressing themselves up or taking a bath or even going to the bathroom. They may have difficulty completing stuff like that. They'll definitely have difficulty solving problems. So, writing a check or doing their taxes or even stuff like driving, things that they can normally do before, they will start having difficulty doing that. They'll have very poor judgment. So, they're very, as far as how to do things or should I do things like dealing with money, for example, they'll have poor judgment with handling money. Things of that nature. Trouble with imaging and spaces. A lot of times they may have difficulty when it comes to a lot of visual imaging. And we could talk more about that. Misplacing items. So they're very forgetful. They put like their keys in abnormal places, or they put items in abnormal places, and they won't remember where it is. And they do that on a frequent basis. We already talked about memory loss, but to get more further into it, they will not remember their daughter. They'll call their daughter their mother. They won't remember if you tell them a number. 5 minutes later, they won't even remember what it is. A lot of times when I'm in the hospital, I know oftentimes there is a little bit of difficulty because they don't come in because of their dementia. They may come in for something like a pneumonia. And so oftentimes it's very difficult in speaking with them because you know that you're telling them, hey, you have pneumonia, that's why you're here in the hospital. They'll shake their head or even say they understand, but you will leave their room and probably not even up to 5 minutes later come back, and they may not even remember who you are, and they definitely don't remember what you told them. So there's a constant having to repeat and repeat what's going on to them because they oftentimes are confused. Again, unfounded emotions, like what I discussed earlier, they can be very irritable. And a lot of times this irritability happens at night. For some reason, during the night, it seems like they're more irritable, and or they can be very depressed, or they just have this unwavering emotion. They not all the time they're even kill, and so you'll find that out with those who have dementia. That lastly, difficulty with words, and it may just be as simple as finding certain words to say, or just in general not being able to put words together and make a very sensical conversation, not being able to make sense when they're conversing, not being able to carry out a very normal conversation. So we'll go more in depth with that. Let me go to the next one. Sorry. So I was talking about the 3 stages of Alzheimer's, or stages in general, and there will be in this image. It talks about the early, middle, and late. I like to talk about it in the early being mild stage, the middle being moderate stage, and the late stage being severe. So this diagram or this graphics gives the very, very good details of exactly what to expect in the different stages. That's why it's very important to know if your loved one has dementia, because it can now give you a sense of what to look forward to. Knowledge is power, as I always like to say. And so in the mild or early stage of dementia, you will see the following. Just some of the stuff that I talked about in the past, in this previous slide, but also in addition, you will see, like I said, trouble remembering recent events, 2, difficulty managing finances, which is the having difficulty with just problem solving. 3, difficulty completing familiar tasks. They may lose track of dates, passage of time. They'll have difficulty with vision, develop problems with speaking and writing words. These are all stuff that I said earlier. They'll be very forgetful. They'll also be very socially withdrawn from family and friends. So they'll kind of be off to the corner. They're not really conversing. Everybody's talking on this end, and they're always off to the corner. Again, they'll have a different change of moods. So they may be confused one moment, they may be depressed, they may be irritable. I get a lot of the irritable ones, especially in the hospital. Maybe it's because it's not a familiar territory for them. They're not at home. So a lot of times they get very confused and irritable because this is not familiar territory. Oftentimes they're repeating questions and statements. Now, before you allude to repeating questions and statements being because of dementia, I always want to let people to know to also check them for hearing loss. A lot of elderly people have hearing loss. And so the oftentimes repeating questions and statements may be because they can't hear. And so that'd be something to look into. But that is also a defining characteristics in dementia. And then lastly, trouble with driving. They may be confusing pedals and traffic signs. So that's within the mild or early stage of dementia. As we get to the moderate stage, then you'll know more serious behavioral problems. They'll be angry, they'll have paranoia, they'll have anxiety, they'll be very suspicious. Then you'll start to see them wandering. They'll be getting lost. If they were independently living at home, You will see them leave the house not knowing how to come back, how to come back to the house. So you'll see a lot of them just kind of just leave. Um, Again, they'll be continue to be repetitive, repeat things often. The anxiety, remember I told you that they tend to have this mood swing changes, especially the irritability in the later part of the day. So as they said, anxiety, particularly late afternoon, early evenings. And this is what we call the sundowning effect. As the sun comes down, then all of a sudden it seems like their emotions change. And this is what we're seeing, especially in the hospital. They'll have, in this moderate stage of dementia, they'll have eating problems. They will need assistance with bathing, with dressing, with personal care. They may be incontinent, which would mean that they're peeing on themselves. They're not able to go to the bathroom anymore independently. They are hoarding. You may see some hoarding signs with those who are in the moderate stage of dementia. There will also the inappropriate behavior, again with those mood swings and irritability, violent behavior. They may have difficulty with speech and even recall. And then this is where you start seeing maybe a loss of coordination. They'll be shuffling, or frequent falling. This disease has affected their motor skills. And then this is in the moderate stage, they'll start to stop recognizing their families and friends. Then now in this late stage, which is the severe stage of dementia, this is where now you start seeing the complete loss of things, such as the complete loss of the ability to communicate. I'm taking care of several patients who have dementia and they don't say a word, or they just grunt, not saying anything, and they're at the severe stage of dementia. They may not smile. They may not recognize people at all. People, places, things, not recognizing everything. At this point in the severe stage of dementia, they're requiring full assistance to doing just daily activities of living, such as dressing themselves, going to the bathroom, bathing themselves. And this becomes a burden sometimes with caregivers. And so, and at this stage, we see a lot of people bring their loved ones in, very distraught, because on one hand, they really want to take care of them, but now that they're totally independent, due to their other, situations that they have going on, they may not able to fully take care of their parents. And I want to say that's okay. There's options out there. Just recognize if your parents need, or your parents, or whoever it is in your family, have dementia like this, and they now need total assistance. There's resources, such as you can have an in-home caregiver. You can have them go to a nursing home. There's just options that are available. And a lot of times in the hospital, we refer them to the social worker or the case manager, who can help with that, with the various resources. You don't have to do this alone. And so this is usually the stage that we start seeing them come to the hospital because of that. So they'll have loss of ability to chew and swallow. And the loss of ability to chew and swallow, just to give you guys a sense of an idea of what that means in terms of the disease, that means that you are kind of towards the end of the disease. Once the patient has a loss of ability to chew and swallow, they're not eating. And again, they come to us in the hospital because of this. We call them failure to thrive. They're not eating. They look very cachectic, and that's a medical term, which I guess you would say they look very skinny, skin and bones. A lot of times, because they're not able to swallow appropriately, when they do try to swallow, instead of it going down into the esophagus, into the stomach, sometimes it goes into the lungs. And then these people come in because they're getting pneumonias from the inability to properly swallow their food into the stomach. And a lot of this leads to infections, and ultimately that is where we see a lot of them die. So it's important to know the various stages so that you're able to know what happens. And once they have the inability to chew and swallow, that's kind of towards the end of the life. And then we start thinking of, what can we do? How do we make the patient comfortable? What the family wants to do, and just so that at the end of the day, the patient's very comfortable. Eventually, they lose the ability to walk. They sleep quite a lot. On occasions, there's some that have seizures. On occasions, there's some that have strokes. We talked about incontinence. We also talked about bowel problems. A lot of times they're constipated. Why? They're not really, when you're not cognitively fully there, you're not wanting to drink. You're not eating. And so you're dehydrated. The body's going to have to get water from somewhere. So it's going to get water from the stools. And getting water from the stools make those stools hard. And they come in quite constipated. I see it all the time. And then lastly, the weight loss. It is awful, Michelle. It is a cruel disease, and you must know it. Oh, okay, Michelle. I just barely saw this. Yes, Michelle. You took care of your grandmother with advanced Alzheimer's. So I was just about to say, you must know this personally. And thank you for taking care of her. And we deal with them in the hospital just for a brief period of time. I can only imagine having to deal with a loved one with Alzheimer's, how much emotional and even physical toll it takes on you, because it is just watching them just slowly get away from what they once were. And you see them and you're like, that's my loved one. But they don't respond to you like they normally did. They become dependent on you. It's very, I see it all the time in the hospital. I as far as how much of a toll it takes on the caregivers. But I always like to tell them, and I appreciate them for their service to their loved ones, because it is something that is just something that you wouldn't wish on anybody. But if someone has it, in your family, it would be something that you would have to step up and just help, because you want their lasting life be comfortable for them, and they not suffer as much as possible. So I totally get it. It is awful to watch. Yeah, the constipation. Yes. Watching a beautiful person lose their mind. Beautiful. I love how you said that. Watching a beautiful person lose their mind. I see it in the hospital, so I could only imagine someone seeing it on a day-to-day basis, how that is. So I just lost my uncle and had a lot of symptoms you mentioned. He fell and couldn't walk, and I think he was misdiagnosed. See, and so that's I can see, and he had a lot of symptoms. So he likely had dementia, because a lot of times, especially like I said earlier, falls are some of the features that happens because they start losing their coordination. And so I don't know what part of misdiagnosed he was, but if he had a lot of the symptoms that I mentioned, he likely did have dementia. And so that's that. So the advanced stage is the weight loss. And then we go from there. Just a second. So not everything that I mentioned is strictly dementia. Some of it is just age related. But with age related changes, meaning as we grow older, we're not going to be as sharper as we were when we were younger. And that's okay. That's just part of life. But how do we distinguish dementia versus, oh, it's just old age? And so I just kind of listed a few things and just to kind of compare and contrast what is dementia and what may just be age related. So, memory loss, yeah, you can have it as you get older. Shoot, I even have it once in a while myself. Um, and so, how is it in dementia? In dementia, they're not able to retain any new information. You give them an information to say, okay, remind me, you give them information and say, okay, Sue just had a baby or something like that. You told them that, oh, Sue had a baby? Yeah, Sue just had a baby. Wow, that's great. Go back to them 5 or 10, depending on the dementia. If they're mild, they may retain it, but definitely moderate and severe, they may not retain that information that you just gave them. Whereas if it's just age related, they may be forgetful of names and some events, but if you remind them, they'll, oh yeah, I remember, yeah, and they'll continue the conversation with you. So there's a little bit of forgetfulness, but not to the degree of dementia. Dementia is like total memory loss. When it comes to dementia and difficulty with tasks and problems, they're not able to conduct tasks and solve problems like before. They're just flat out not able to do it. Whereas if it's age related, they may still be able to do some of the tasks and some of the problems, solve some of the problems, but whereas maybe years before they were able to do it at 100%, maybe now they're able to do it at 80%. Some of it, there may be some errors or mistakes that they've made that if their younger self wouldn't have done. As far as time, when it comes to patients with dementia, they don't recall it at all a lot of times. And whereas age related, they may be confused, but they're like, oh yeah, oh wait. They may say something, they're like, oh no, wait. No, it's 2023. They may say, oh, 2022. Oh no, wait, no, I mean 2023. So they're able to kind of correct themselves a lot of times. When it comes to dementia and visual task, they have complete difficulty with driving, with things like reading and stuff like that. Whereas age related, they may still have those difficulties, but it may be due to stuff like cataracts, which is very, very common, especially as we get older, to have cataracts. So it may just be another ailment that's causing this. Or it could be also because, they need reading glasses. Again, as we get older, our vision starts to get a little bit blurry. So they just may need reading glasses. When it comes to conversing in a dementia patient, they'll have difficulty carrying conversation. They'll keep on repeating themselves. They'll have trouble following the conversation. Whereas with someone with age-related, conversing, they just may have just certain speech impediments. They may have difficulty finding the words. They'll be like, yeah, like, they'll be like, and I was going down the street to, what is that place again? What is that place? Kroger? Yeah, Kroger. Something like that. That may be them. So when it comes to forgetfulness in a dementia patient, they may have, like we said, they're frequently misplacing things, frequently forgetting, that they turned on something, a stove or something like that. Whereas somebody age-related, they'll occasionally forget, occasionally misplace, but they'll also start to backtrack and try to retrace their steps to try to find whatever they forgot. And then lastly, mood changes, whereas if in dementia patients it's very frequent. Age-related, it's very occasional. It's not as frequent as someone in dementia. So in general, memory changes due to normal aging are usually mild and don't worsen greatly over time, nor should they interfere with a person's day-to-day functioning. So even though they may have a mild memory loss, have some of these features, they're still independent and able to do their day-to-day function. And keep in mind that may be the case in those with mild dementia, but as the difference between age-related issues versus dementia is it gets worse over time. So I think, oops. So my last, my last slide is this. What can be done? And this is part of, what can be done, essentially. What can we do for those who have dementia? So I will start with this, but I know we'll have to dive more deeper in the next part too. So safety first. So these are the various things that are affected when someone has dementia. First of all, as we had just talked about, falls. There's because especially in the moderate, as we saw, the moderate stage, the severe stage, they're starting to lose coordination when it comes to walking. So how do we help with that? A lot of times it's to make sure that their surrounding areas fall proof. So maybe they're not being in such high beds. Maybe if you're gonna put rugs, put them in. Don't make sure you put the anti-slipping pad on the rug so it doesn't cause slippage. Just being able to make sure the home is fall proof, and I will talk more about that in the next. Hopefully in the next part too. Medications. As people who have dementia start to lose their memory, they're going to lose also the ability to know how often and how much medications they take. Another reason for patients with dementia to come into the hospital is due to accidental overdose. They take an extra couple pills of the same pill, and they're either acting funny and their family brings them in. So at this point of time, when you're starting to see that your loved one is having trouble with simple things like their medications, it's time to take ownership of their medications. So a lot of times we tell patients to start putting their medications in pill boxes that have the different dates: Monday, Tuesday, Wednesday, Thursday, Friday. So they know that on Monday, these are the medications you take. On Tuesday, these are the medications you take. Wednesday, Thursday, Friday, Saturday, Sunday. And see if that helps. As with dementia, it's a progressive thing. So if it helps initially now, great. Eventually, that you'll probably have to have the total ownership of the medications and just start giving it to them if they can't even be able to remember to take medications on a daily basis. So, and also know that there's resources such as, home health can come in and help with medication management as well. Home health nurse can come in and help with that. Wandering, that is also going to be something that is just something to consider, especially as the dementia gets worse, especially in the moderate to severe stage. So a lot of times what you could do is you can have a meta alert, have identification tag on the person, have a GPS device that they have on them. So if they go or wander off, they can be located. These are just different things that, you should have to start thinking about with those who have dementia. Driving. Initially, as I read, maybe in the mild stage of dementia, they're able to still drive, but they have to be told, obviously, that they do have dementia, and this is something that's progressive. Eventually, that ability to drive is not going to be there anymore. And so, as I've read, they suggest that doing a reassessment of their driving abilities every 6 months is probably key. Having a driving test every 6 months to make sure they can still drive is likely key. Cooking, same thing with cooking. Eventually they'll be forgetful to turn on that stove or turn it off. And that could be a potential fire hazard. So I've read that they don't recommend gas stoves for those who have dementia, and even the electric stoves can be a bother. But also be very keen to their abilities, because if they're starting to be very forgetful, maybe they can't cook anymore. The safety is first. And lastly, confusion. What are some of the things family members can do? Well, redirection is always key. Being able to remind them. They'll ask a lot of questions, and it may even get to the point that they're asking so many questions it gets on your nerves. But redirection and giving them answers to those questions so that they can get out of that confusion state will help them overall. Not to be too agitated, not to be too irritated because they don't know what's going on. And maybe it may even be in the beginning just putting different like reminders, post-it notes, so that they are aware of their surroundings, aware of who they are, that sort of things. So we'll talk more about, what caregivers can do or just family members can do to help patients who have dementia. We'll also talk about, what are ways that what you can do to help prevent yourself from having dementia. And then we may even talk about some of the treatment options. Although, again, all those treatment options, they don't treat it. It's really just to slow the progression of dementia. So a couple things that people say is you got to watch them like a hawk because they'll sneak past you with certain things over time. Exactly. You have to watch them as a hawk. And you have to be aware of just how much they decline over time. It may be difficult for you to understand that no, this is something that these are some of the functions that they've lost, and maybe differently think about that. But safety's first, and if you start realizing that these things that they normally do they're not able to do, is a good thing to start relinquishing those duties from them. Okay, it's just like Josephine says, home health is a huge help, and it is, and a lot of insurance do pay for it. A lot of people don't know this, so home health is key to helping you out with all of this. The medication one is very difficult when they're still trying to retain their independence. And I get it. I totally get it. That's why I say there's a little bit of compromising that has to be done. Or there's a way you can probably tell them in a way that they may be able to to maybe compromise, but it's one of those very difficult situations and conversations that need to be had. Because again, like I said, there are frequent admissions that I've had to do because these patients overdosed accidentally on medications. Okay. Trina, I read what you said. I'm going to say this. It's very expensive to get outside help, $750 to $1,000 monthly. My life has stopped caring for my mother. I'm no longer her daughter and only her caregiver in her eyes. It's very depressing for a caregiver. There truly isn't enough support out there for caregivers. My mother suffers from vascular dementia, Lewy body disease. I am so sorry, Trina, and I so totally understand your frustration. In part two, I'm going to talk more about the various resources that can be for caregivers, specifically to what you have talked about, that you can do as far as to help with your mother. But this is a very devastating disease. And it's not only a burden for the patient, but also for those around the around them, their loved ones. So my heart goes out to you. I get it. I will talk more about the resources that I know that can help you and alleviate you. Um, Dolores Collins, I appreciate this discussion. My 64-year-old sister is going through this. We just processed her retirement due to the memory loss and getting lost. She couldn't continue in her job. It seems like the decline is progressing so rapidly. It's heartbreaking. I'm worried about her living alone. I know she shouldn't be. I need to know where to begin to find resources in preparation for finding a facility. Where do I start? The first thing you start that I can think of is getting a social worker or case manager. They know all the resources that you can obtain, and how you can do that is usually they're usually tied, and this is I only know from the medical side, they're usually tied to her primary care physician. So the primary care physician, you can let them know, hey, this is the situation. I need to when we with the family, we as a family want to start preparations of finding a place for my sister. Can you help? And they should have a social worker or case manager who can help you with that. I know definitely in the hospital we have it, but I'm also 100% sure that the primary care providers have it too. Any additional resources after that, I will let you know the next time we meet. And I want to bring someone on, but I won't say definitely I'll have this person on to talk about this. I won't say that yet until I get this person to say yes, that they will come on with me in this live. But if I can, I will bring also a specialist who can help us with this. One last thing. This is a really, really, first of all, this is a very, 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 very important topic, because there's a lot of burden on the family members and just the patients. I mean, can you imagine just not being able to remember, having the memory loss, not being able to do what you normally have been able to do for many years, the loss of independence? I mean, that can take its toll on any human being. So having them being taken care of in a humane way, in a peaceful way, in a comfortable way, and then also having the caregivers being supported, so it's not just a huge burden on them, is the goal. And so we'll talk more about it in the next part 2. But I am so thankful for all of you just sharing your stories, and just sharing your thoughts. And if anyone who sees this after this live has any more questions or thoughts about this, feel free to jot it down in the comments section. But we'll definitely have another part 2. And so we can go from there. And I know I've gone beyond my time, but thank you guys so much for seeing this live. Again, this is Q&A with Dr. Mercy. We come here every Friday, and so around this time. And so I hope to see you guys again on our next session. Hope you guys have a wonderful weekend. And until next time, peace.